go ahead and get started. First and foremost, I want to thank everyone for being here, the media. We just wanted to come together to voice the concerns that we have in the interest of public safety. And we do want to just preface right off the bat that this is a women's health issue. No matter what you feel about pro-choice, pro-life, this is not the issue here today. The issue here today is women's health and what has gone on in the name of women's health and what they've been exposed to. So again, the purpose of this press conference is to share the results and the concerns generated by the Health Department's inspection of the Volunteer Women's Medical Center located directly across the street from us and the Knoxville Center for Reproductive Health on Clinch Avenue near the UT campus. Both clinics are ambulatory surgical treatment centers. They must adhere to the standards established by the state under the rules of Tennessee Department of Health Board for licensing healthcare facilities. This document and all the correspondence referred to in this conference is located in the press packet, which will be available at the conclusion of this press conference. A brief summary of why and how this investigation was requested follows. On November 18, 2011, a request for the inspection of both clinics was submitted to the State Department of Health. In this initial letter, we requested that the facilities be inspected for basic cleanliness and compliance with OSHA guidelines. Additionally, we voiced concern regarding the adherence to the established procedures for releasing patients after surgical procedures were performed as specified by the Tennessee patient care laws. This included verification of proper certification and licensing of all personnel involved in patient care, surgical or non-surgical. We also wish to verify that patients had the necessary information they needed in case they encountered post-operative problems, and whether attending physicians had hospital privileges at nearby hospitals. What prompted this initiative was an observation made by several people last October, which caused us concern. A young woman came out of the clinic across the street and proceeded to sit down on the sidewalk near the clinic's front door. We observed her for over a period of time, and as she sat there, her head down in her knees, eventually laying down on the ground in the fetal position. We were concerned that she may have been discharged after a surgical procedure with no one responsible for her well-being. It was approximately an hour before her ride came. She seemed very despondent, and we were concerned for her emotional and physical well-being. This incident prompted us to ask the following questions. Are patients receiving appropriate discharge information? Are patients discharged to a responsible person? Are patients given post-op information concerning where to seek treatment if problems arise? Do patients spend the correct amount of time in the recovery room under the supervision of a registered nurse? Are post-operative patients given medication to help make them comfortable? Are the guidelines established by the state of Tennessee being followed? Because of this observation, we requested of the Tennessee Department of Health a review of these two clinics regarding their day-to-day operations and whether they were in compliance with state guidelines for ambulatory surgical centers. 6 weeks later, December 29, 2011, we received acknowledgement from the Tennessee Department of Health that our complaint was received and that an inspection would be conducted. We were told that we would be notified once the inspections were complete. It was further explained in their letter that due to the high volume of complaint investigations, their response may fall outside the prescribed time frame. 5 weeks later, on February 2nd, 2012, we received a call from the Tennessee Health Department that the complaint investigation had been transferred to the Knoxville branch for action. On March 1st, concerned that we had not heard anything in a month, we emailed the local branch of the health department regarding the status of the inspections. The next day, they responded with the following email message, quote, "The investigation has been completed and deficient practices were cited, which requires the facility to submit a plan of correction. I am unable to provide you with further information related to your complaint other than that which I am providing." End quote. 2 letters, one for each clinic, dated on March 1st, the day of our email request, were received 2 days later. This is when we first learned that the Knoxville Center for Reproductive Health had received an unannounced inspection on February 21st, and Volunteer Women's Medical Clinic had received an unannounced inspection the next day, February 22nd. In both letters from the health department concerning the investigation of these clinics, it was stated that, quote, "The surveyor did find that rules and laws were violated at the time of our visit, and that the agency will take action since the surveyor determined the facility was not doing what they were required to do at the time of the inspection." End quote. In addition to these violations, which will be read in a few minutes straight from the reports by Dr. Rod Briggs, who is a maternal fetal medicine specialist, several other violations were found in researching public records regarding licensing of employees of the Concord Clinic across the street. At this time, Mary Ann Briggs, RN, will give her findings of those licensing violations. A side note to that, before she reads her report, we specifically asked... Hang on just 1 minute. We specifically asked if all the licensing had been verified at the time of the inspections, to which we had been told they had been.
As a registered nurse licensed in the state of Tennessee, I was asked to review and verify licenses of listed employees at the 2 ambulatory clinics. Mrs. Morris stated she had specifically asked the health department if licenses were checked, verified, and current for all employees. She was told that was completed and that everything was in order. Using the state of Tennessee website, Board of Medical Examiners license verification option, the following was discovered. At Volunteer Women's Medical Clinic, one employee listed as the clinic's, quote, nursing director holds only a general lab technician license. This employee has no nursing license of any type, but is listed as the nursing director. This same employee's lab technician license is listed as active on probation for the following reason: professional service while under the influence of a controlled dangerous substance. The court order for this is a public record and states, while employed at the Jackson Clinic as a laboratory technician, the respondent provided professional services while under the influence of a controlled substance without valid medical indication by testing positive for cocaine. The respondent's conduct impaired the respondent's ability to competently provide medical laboratory services impacting the health, safety, and welfare of the public. At this time, Dr. Rod Briggs will review the violations.
Thank you for all coming. Good morning. I'm Dr. Rod Briggs. I'm board certified in obstetrics and gynecology for 25 years. I'm also board certified in maternal fetal medicine, which is the practice solely of those women who have high-risk conditions. 2 months ago, as Lisa stated, I was asked to review the reports, which are, by the way, in the public domain. They're on the internet. Anyone here can access that information. I was asked to review those violations and give my opinion, since this is my specialty, obstetrics and gynecology, of these two clinics mentioned in the report. Let me stress that I was asked to give my medical opinion. This is not a pro-choice. This is not a pro-life opinion. This is a medical opinion. The violations, after I read them, were so egregious that within an hour or 2 hours after calling Lisa, I called the state health department and went up the chain of command, which added some time to this process that we're having today. But I felt it important from a medical standpoint. I've been trained to do so, go through a chain of command, and that's what has been done. I will now review some of the violations that have been covered in the last 2 days on the news. However, I think they deserve further elucidation and clarification, particularly from a medical standpoint. So I'll begin with the clinic behind us. The ASTC, according to state guidelines, must provide a sanitary environment to avoid sources and transmission of infectious and communicable diseases. There must be an active performance improvement program for the prevention, control, and investigation of infections and communicable diseases. I stress this and read this because, as you will see in just a minute, the egregious violations that have been performed by this medical facility. The inspection noted that there were 2 autoclave machines. Any of you in the health field know that autoclave machines are machines that, by pressure, high temperature, and time, sterilize instruments that we all need to perform and take care of if we operate a private office or work in a hospital, or in this case, an ambulatory care center. One of the machines was not working. The other machine tested positive for spores. Spores are latent phases that can downwind or immediately cause infections from viruses, bacteria, and so on. In an ambulatory surgical care center with instruments that have been autoclaved in a proper fashion, these instruments are then dried, wrapped appropriately in sterile containers, and used at the appropriate time, but they're time sensitive. None of this was performed. None of this was performed. So it is quite important to have instruments that are clean if they're going into a body cavity. In this case, with this type of ambulatory care center, and there's many of them in the state of Tennessee, instruments will be introduced into the vagina, into the womb, into the uterus, which is a tremendous growth area for bacteria. This can lead to serious morbidities and possible mortality, such as death. Instances where the uterus has been perforated due to this type of instrumentation, enters into the cavity, the abdominal cavity, and you can take it from there. If the instruments aren't clean when these procedures are performed, what an egregious medical situation we have here. So again, the state guideline says there must be continually active recording that this is performed, that the materials used in cleaning the instruments, the spore testing from an outside agent, which was performed, and this outside agency did notify this clinic that, hey, you're positive for spores on the remaining autoclave machine. The other one's down, remember. Nothing was done. They kept using that machine. So there was no log sheets to log in specimen time obtained, results came back, just like our offices do just for the generalized performance of pap smears. We have a log in and log out sheet. Patient notified. None of this was performed. In addition, there was a machine to use to perform, a laboratory machine used to assess the hemoglobin hematocrit level of a patient. This is pretty standard procedure, and they found blood on this machine. So blood on this machine, used by employees, we hope they had gloves, and they probably did, but they're still touching the blood on that machine. So 1 or 2 of these lab personnel or office personnel would be assisting the physician to perform these procedures, handing him instruments, et cetera, and you can see the implication. I'm touching this machine from one patient to another. I'm handing these instruments, which may, even if they were autoclaved, it was improper because the machines are not working, to the doctor, who's then performing these aspiration procedures, the curetting procedures, et cetera. Egregious. finally, it's concerning the machines, the environment that we see, whether it's this clinic, my office, any clinic, this from a microbiologist standpoint would be a virtual cesspool. A virtual cesspool. It's not that I have a glove and I touch a spot of blood that contains so many microbes for the spread of what? Hepatitis A, B, C. C is, as you know, can involve downwind and it's very difficult to diagnose, hepatocellular carcinoma. HIV, we all know what HIV is. And there's millions of other bacteria that can be on those machines in this lab because of the improper or lack of cleaning procedures performed. These were cited. How long have they been going on? No one knows. Has it been weeks? Has it been months? Has it been years? No one knows. There are no records. Maybe since the last inspection, that would be one point to look. My concern after reading these reports was one thought and one thought only. Where are these women and what are they going through? What is the potential morbidity? What is the potential mortality of this? Have they been notified since the state inspection? Were they notified at all, ever? I don't know. No one knows. But you see my point. Moving on, there was another violation. They were storing cleaning materials. What were those cleaning materials? No one knows. The containers weren't marked. Was it ammonia? All of you know what would happen if you drop one little specimen of ammonia in your eye. You would lose your sight. So these cleaning agents, if they were cleaning agencies, were mixed with patient supplies. So disposable drapes, paper drapes that we would use on an examination table, other gowns, they're stored with the cleaning materials on the floor, on shelves. It's just unacceptable for any ambulatory surgical center, regardless of the type of center that's across the street. Again, this is about medicine. It's not about this type of clinic, pro-choice or pro-life. It's about minimum standard of Tennesseans, what we expect in the medical profession. Moving on. All ambulatory surgical centers are required to have crash carts. Crash carts that you all have seen on TV are used to have medications to, if someone has a sudden cardiac arrest, if they have bradycardia, slow heart rate, if they have breathing issues, there's IVs to resuscitate, to give crystalloids, IV solutions. All of these are on the crash cart to help facilitate and help give EMS time to get there, to save these patients. After these type of procedures, which is again my specialty, a lot of women are at a tremendous risk for bleeding to death, losing their uterus, showing up at the local hospital because they will not be followed anywhere else, dying. There's medications on that crash cart to use. Every single medication on the crash cart was expired. Every single medication. Unacceptable. Unacceptable by any clinic, anywhere. A clinical director of these facilities is responsible for making sure, again, ongoing paperwork to make sure these things are satisfied, they're checked off, they're done. Again, not done. Vaccinations. It is required in most clinics and generalized physicians' offices to offer the annual influenza shot, H1N1 as well. It's particularly important in this type of clinic and in my specialty because the two most common subset of patients affected by H1N1, and there were many deaths 2 or 3 years ago when the last epidemic occurred, is to pregnant women. These women were pregnant. So, if the staff does not receive their vaccinations, what do you think the risk for these pregnant women that come in are? Tremendous. Not even offered the vaccination. And the last time they did was in December of 2008. We don't know past that because, again, there were no records. Moving on, the part of the crash cart is to have tracheotomy instruments. In other words, if a patient can't breathe for whatever reason, you may have to perform a tracheotomy, although I don't know that there's anyone available in this clinic to do it. Laryngoscopes to visualize the canal to place the tube so they can breathe, at least oxygenate them until EMS gets here. Don't work. No batteries are not available, can't find them. So these were some of the initial egregious violations that I read in the first hour and which caught my attention. Bear with me one second. I want to make sure that I cover everything. Moving on to the second clinic, the one on Pletch Avenue. Contrary to the news report that I heard, I'm not sure that these were thorough investigations. They were impromptu, for sure. I don't know how thorough they were. The Pletch Clinic was giving out birth control pills that had expired in 2010. So, to me, that's a pretty egregious violation, and that's your line of work, to counsel, get birth control patients come into your practice. Those pills, as stated on the news, which I saw, like many of you did, had been pushed to the back of the shelf, and they were expired in 2010. But that really didn't violate any safety issues, but I think not. I think it did. And again, the question has to be asked, where are those women? Did those women have a baby and give birth? I hope they did, if they got pregnant, because the birth control pills certainly won't protect them, and that was their goal of going there. Whether you agree with birth control or not, they went to that clinic expecting it, but they didn't receive it because the tablets are outdated. In conclusion, inspection of these ambulatory clinics should be no different from my office, wherever my office is, or anyone doing surgery. They should be inspected. They should be re-inspected for patients' concern. My concern after 25 years of doing this is as follows. Whether you're pro-choice or pro-life, your daughter, your sister, your mother does not deserve to go in for a ambulatory surgery, i.e. in this case, a termination of pregnancy, and die from it. They do not deserve to go in and have their uterus so damaged to lose their uterus and maybe live, but lose their uterus. They do not deserve to go in and show up at a local hospital and receive 20 units of blood, and stay in the hospital to survive a severe infection. No one deserves that in this day and age. Modern medicine should prevent that. Our state health department should prevent that. Lingering questions for me are, with these egregious type of violations, should these clinics be closed? Should they be inspected on a more frequent basis? I think so. I think in my office, I would never let this occur, but if it did occur, I would expect them to come back and inspect me. So, again, these are egregious violations. I'm shameful to say that this exists in our modern age with the technology that we have. It doesn't have to be that way. Again, let me emphasize, my review was totally non-pro-life, pro-choice, and I've tried to explain, regardless of which camp you're in, this should not exist in this century. These diseases that I'm talking about, I see on a weekly basis. I see women come in transported to my hospital with a certain type of bacteria, alive in the AM, and they're dead at night. 18-year-olds, 20-year-olds. It's a serious condition. It's a serious problem. And that's from all medicine, not just these type of clinics. So with that, I'm going to end. We're not taking questions, but I hope I've elucidated some of my issues with this.
Just to conclude here, thank you, Dr. Bergson. We hear much today about the importance of women's health, about women's health care, but as these inspection results demonstrate, there is still much that needs to be done. No one should have to wonder when they go into a clinic if they are being treated with unsterilized instruments. that might be contaminated with blood-borne pathogens, if they are being given medication that is expired, if they are being treated properly by properly certified and licensed personnel, or if they should have problems that the necessary, mandatory, life-saving equipment would be present. These violations demonstrate that was not the case. Patient safety was clearly at risk. Ultimately, the doctor over the facility is responsible for the direction and coordination of the medical programs as stated in the Rules and Regulations for Licensing, page 10, item 9. Given what we know, there appears to be a variation in the enforcement of state standards, which leaves us with the following questions for the health department. When it was discovered that the autoclave was not functioning properly, shouldn't the doors to the clinic have been closed immediately out of concerns for bloodborne pathogens? How many women were possibly exposed to serious infectious diseases during the unspecified period of time the autoclave was not functioning properly? Shouldn't a public alert have been issued for those who were patients in the clinic during the time the autoclave was malfunctioning, so they can have themselves checked for hepatitis B, HIV, MRSA, and other infections? Why were there no fines for such violations that any other doctor offices would have likely have incurred? Why did it take the concerns of Dr. Briggs to get the health department to go back and conduct a follow-up inspection instead of just a desk review of the clinic's corrective action to these violations? Why did it take 2 months to get the report when the letter prior to the inspection said we would be notified when the inspection was complete? Why was it necessary for us to have to contact the health department in order to get the results of the health inspections that we had requested in our formal complaint? We were never notified. We contacted them. While we are grateful for the investigations that have been conducted by the health department, it has been difficult at best to get the information. We were asked by Nashville to hold off on this press conference, which we honored, to allow them time to investigate. But this has only added to the perception that they are more concerned with protecting the clinics than the public. It took approximately 5 months from the time we first raised the concern until we received the reports. It was the persistence of many, many concerned citizens that has brought this to light. We will keep you posted on further findings. Finally, 2 questions have been asked repeatedly of us, and I'd like to address those now. The first being that we have an agenda. And isn't this just about abortion, an abortion issue? Dr. Briggs already pretty much referred to that, but I wanted to address it as well. While it's true that we come here often to pray for an end to abortion and for everyone involved in the tragedy of abortion, including the staff who work in the clinics, the fact of the matter is that our concerns are first and foremost for the safety of all the women who were treated in these facilities